The symptoms are subtle and often easily confused with other conditions, making ovarian cancer very difficult to diagnose. A Richmond-based organization called CancerDancer is helping the community be more aware. Esther Win Mueller, co-founder of CancerDancer, and gynecologist Cecilia Boardman are with us. And I've just discovered, welcome ladies.
Thank you. Good morning.
I've just discovered, getting right into it, gynecological oncologist. So this is key to this conversation that we're going to have. Ovarian cancer is happening often, and it's one of those things, learning from CancerDancer, that is difficult to diagnose.
It's true. Symptoms involve abdominal pain, cramping, bloating, having irregularities in your digestive system, and those are things that happen to women all the time. We don't think anything of it. We're busy, we go on, we ignore it. But if those symptoms are happening for 2 weeks, longer than normal, then that's when you should probably seek out a doctor.
2 weeks is kind of that magic barometer of if something hasn't resolved in that time, you need to look at it more closely. And it's not easily diagnosed because, as you said, we're ignoring it, or it might be being brushed off as, well, just go get some rest or take it easy or that sort of thing.
Irritable bowel. People get misdiagnosed with lots of things. But women know their bodies. If something is not quite right, that means something is not quite right. And that's when you should seek excellent health care from the right doctor.
Which is what you eventually went on to do, or actually did pretty early in your journey.
I did early in my journey. You know, I didn't know anything about this when it happened to me. I was 42 years old and I never knew anything about it. So I did have a gynecological oncologist when I started, and that is important. But I look back, and had I known the things that I know now, I might have done some things a little differently. Although, knock on something.
Knock on wood.
I'm still here.
And we're glad you are.
Well, thank you.
CancerDancer is one of these organizations in the community making an impact. October is the month of awareness.
September.
September is the month of awareness. So we are in the midst. We need to be sharing the message. What is CancerDancer doing in the community?
Well, we do a lot of things, actually. We have a survivor brunch that happens about every 3 months. So if you are an ovarian cancer survivor, then we would love to have you. And just look up CancerDancer on Facebook, anywhere you'll find us. And we're having one this Saturday where we get together and women learn from each other and get support. We make these beautiful comfort kits for women that when they first get diagnosed, they get those. It's got blankets and earrings and all kinds of nice things in it, but it also has a card to get to other women so that we can get together. And then we do things like this, or talk to, say, sports teams and college campuses to make women aware of these symptoms and risk factors.
And Dr. Boardman, that's what we were saying when we got started this morning. Gynecological oncologist. Is this a pretty niche specialty, or is this something that's out there but folks might not know to ask for?
Right. We're a small community. There are, I think, 7 of us in Richmond at this point. We are a subspecialty of gynecology, and I think truly Esther's message and my message is patients need to be an advocate for themselves. If they're concerned, if there's a family history, if the symptoms persist, ask the question, could this be ovarian cancer? Do I need to get tested? Do I need to seek a specialist? And ask for that referral. You may not need to know gynecologic oncologists by name, but recognize that there are specialists for women with ovarian cancer that do exist.
We've talked about it being difficult to diagnose in the sense that it might not be recognized or readily recognized, but early detection is key, so that's what makes it particularly challenging because it can escalate so quickly.
Absolutely. And I think for women who are at increased risk, particularly based on family history or genetic risk, it's very important to be very proactive with screening. We don't have phenomenal screening tools, but we do have a few, and that can allow for early detection.
Esther, how did you know to ask?
Well, with me, I had the symptoms, and people that are diagnosed, 90% of them, when you look back, had symptoms. So if people, knew what to do, they could be in that category of people that get caught early. But I had bloating, I had abdominal pain, I knew something wasn't quite right. I did go to the doctors, and we all thought they were ovarian cysts, and that belief persisted for 6 months until I finally had surgery to remove the cysts, and that's when I woke up after surgery and was told that they weren't cysts.
And 6 months can be a lifetime.
I mean, the fact that it was already causing me symptoms makes me believe that that 6 months may not have made a huge difference, but it sure would have been nice to know in the very beginning.
Well, thank you for the work that you're doing in the community, both of you, very much. And thanks for being with us this morning. We are aware in September, the month of awareness.